After surgery or chemotherapy, how do we know if there is any cancer left in the body? Currently, clinicians rely on imaging and blood tests to look for signs of remaining cancer or recurrence of cancer. The DNA that cancer cells release into the blood is called circulating tumor DNA, or ctDNA, and is typically present at very low levels. But are imaging and conventional blood tests sensitive enough to detect molecular traces of cancer in the body? Signatera is a new blood test that can identify molecular residual disease or recurrent cancer sooner than existing methods by detecting the presence of ctDNA. Signatera is a personalized tumor-informed test optimized to detect ctDNA with high sensitivity and specificity. First, whole exome DNA sequencing between the tumor tissue and normal cells are compared to identify mutations unique to the patient's tumor. Next, for each patient, a Signatera test is created to track the top clonal mutations, similar to a unique tumor signature. This personalized, tumor-informed test can then be used to detect, measure, and track extremely low concentrations of ctDNA in the blood during treatment and remission. Physicians can use Signatera to support more informed treatment decisions by determining risk of recurrence, detecting early recurrence, and assessing changes in ctDNA levels in response to therapy. A positive Signatera result means that ctDNA is detected in the blood, and there's a higher risk of cancer returning without further treatment. A negative Signatera result means that ctDNA was not detected in the blood, and data shows the risk of cancer recurrence is greatly reduced. Serial negative Signatera results further confirm decreased risk of recurrence. Revolutionizing cancer care begins with revolutionary testing. Learn more at nateraoncology.com.